Assalamualaikum and hello everyone. My name is HAFIZAH and this is my self-study module and I want to talk about neurologist as the specialist I choose followed by the meningitis disease as we progress. So, before we begin, have you guys ever heard about the neurologist or do you even have any idea about this specialist? Basically, a neurologist is a medical doctor who diagnoses, treats, and manages disorders of the brain and nervous system. A neurologist knows the anatomy, function, and condition that affect nerve and nervous system that act as a command center. As we can see here, these are the best neurosurgeons in the world. The first one is Dr. G. Balamurali, a neurosurgeon in India. Some of his extensive area of specialization in the field include intensive spine surgery, minimally invasive neurosurgery, and treatment of cerebral spine and tumor. The next one is Dr. Gerardo Conesca Bertrand. He is a chief of a neurosurgery at multiple prestigious institutions in Spain. And finally, here, Dr. Akin Akakin, the most in-demand neurosurgeon in Turkey. He is well versed in treating a wide range of conditions associated with neurosurgery, such as epilepsy, cerebral edema, and also astrocytomas. The nervous system is divided into two main subsystems, the central nervous system and the peripheral nervous system. Based on these pictures given, the purple color there is represented as the central nervous system, while the yellow color represents as the peripheral nervous system. Central nervous system consists of the brain and spinal cord, which occupy the dorsal body cavity and act as the integrating and command center of the nervous system, while the peripheral nervous system, this is the part of the nervous system outside the central nervous system. It consists mainly of the nerve that extend from the brain and also from the spinal cord. Then, this is how the sensory information is transmitted. I would like to give a scenario where our hands get in touch with the flame directly. First, the receptor detection. Receptors are the sensory structure that detect changes in internal or external environment. There are three types of receptor: somatic sensory receptor, spatial sensory receptors, and visceral sensory receptors. So here, the sensory receptor on the hand will detect the heat from the flame. This transmission can be seen on the red line. Then the receptor stimulate and trigger a nerve impulse. The nerve impulse is transmitted along the sensory neuron to the central nervous system. The sensation of the heat is sent to the brain through the synapse to the relay neuron. From the relay neuron, the nervous impulse is transferred into the neuron as known as the muscle or gland. This can be seen followed by the blue line. The motor neuron transferred the nerve impulse to the effector known here as a muscle, so that the finger can be moved away from the heat. We move on to the next page. This is the brief of how the impulse transfers through a synapse. First, impulse reaches the synaptic knob and stimulates the neurotransmitter to release into synapses. The neurotransmitter combines with the receptor on the dendrite of the receiving neuron. Then, binding stimulates the initiation of the next impulse so that the impulse can be transmitted through the neuron. This process is continuous from affector to effector. Our nervous system, of course, cannot be the exception when it comes to a disease. As a neurologist, here are some of the common neurologic disorders of a neurologist may treat, including Alzheimer's, brain and spinal injury, encephalitis, stroke, Parkinson's, and meningitis. Meningitis get my attention since I have never heard about this disease before. I would like to share more information about this disease. Meningitis is an inflammation of the protective layer surrounding of the brain. and also spinal cord. We call it as a meninges. The meninges protect the brain and spinal cord from injury and provide support and structure. They contain nerve, blood vessels, and protective fluid. We call it as the cerebrospinal fluid. Infection disease like viruses or bacteria or non-infectious conditions like cancer or head injuries can cause meningitis. Based on the illustration given here, meningitis usually attack on the area of the brain. The upper side is the normal meninges looks like and the left side is the infected meninges look like. Bacterial meningitis is a severe type of meningitis that can cause the tissue around your brain to swell, interfering with blood flow, and can result in paralysis, stroke, leading to long-term complications and even death. These are the symptoms of bacterial meningitis. You may have a fever, headache, nausea, photophobia, which are afraid of the light, vomiting, lethargy, confusion, and also stiff neck. Here, for the diagnosis, the provider may collect samples of your blood, urine, or even mucus. They will also perform a lumbar puncture to collect a sample of your cerebrospinal fluid. This is the fluid that surrounds the spinal cord to determine what is causing your infection. They may ask you to either lay down or sit down while taking your cerebrospinal fluid. And finally, the treatment. Healthcare providers usually treat the bacterial meningitis with an IV, intravenous with an antibiotic with it, also with a corticosteroid to bring down the inflammation. Then we finally reach the end of my video. Have a good day and thank you.